We're joined now by Judy Murphy, the Deputy National Coordinator for Programs and Policy in the Office of the National Coordinator for Health IT. She's also Monday's plenary speaker, and her topic, yesterday, today, and tomorrow. Judy, thank you for joining us.
Thank you.
As I just mentioned, you're providing one of the highlights of the conference, Monday's plenary speech called Yesterday, Today, and Tomorrow. Can you give us a preview?
Sure. I'm really excited about where we're at these days in terms of health IT. We're really turning a tipping point, and 2012 has been one of those years, specifically in terms of getting electronic health records really implemented in the majority of our clinics and our hospitals. So in the hospital scene, we've had over 75% of the hospitals receiving meaningful use payments already, and in the clinic space, we've got about 25%. So that's kind of the past. You know, that's talking about where we've been and how we got where we are today. Today, we're faced with looking at the stage 2 requirements, and there's a specific focus there on consumer e-health and on interoperability. So I'll talk a bit about those two topics. And then when we think about the future and where we really need to go, it's decreasing the emphasis on health IT and really increasing the emphasis on what health IT can do. So looking at health IT as a means to an end. So we call it the meaningful use of meaningful use, or thinking about, excuse me, how we impact the 3-part aim, how we actually impact clinical quality outcomes.
What leadership roles do nurses take relative to informatics and improving healthcare?
So nurses are really the foot soldiers in our nation. There's 3.2 million of them, and they continue to be the most trusted professionals. In that role, there's a way that nurses can influence that is different than any other. And so when we think about making a change, like looking at patients getting more engaged in their care, nurses would play a key role in that because they can be the patient's advocate, they can be the patient's teacher, they can be the one that can help change that tide. So there's that huge component related to the patient's behavior. Then of course, there's the whole area of the quality of care and the nurses' impact directly in the use of health IT and how they use it to impact the quality of care. And there's all sorts of applications within our electronic health records that help nurses do their jobs better as well.
Now, the ONC is doing a listening session on Tuesday called Clinical Quality Measures Stage 2 and Beyond. Can you give us a preview of that, and what's the next step?
Absolutely. So clinical quality measures have been around a long time, but they've been paper-based measures. And so traditionally what that meant was going back into the paper record and looking for the information in the record and, you know, mining it out that way. As we move toward electronic health records, it opens up a lot of new opportunities for the way we think about mining those quality measures. So we can put things into the electronic health record up front that we then are able to look at retrospectively and understand what's going on. But that's, again, kind of the today part of this. As we think about the tomorrow part, that's really where we take the quality measurement and turn it into quality improvement. So we make sure that concurrently we're actually impacting all of the care for the patient to make sure that best practice is always being implemented and that we're using what we learn from our electronic health records and this data mining to actually change what we do for the patient. So that's the clinical quality improvement cycle, and that's really where we're going.
What can you tell us about some of the other listening sessions that you're doing?
So one of the things that the ONC is, well, ONC stands for the Office of the National Coordinator. So the concept of coordinator is that we are a organizer, we're a convener, and a big part of that is listening. And so the listening sessions are really set up so that the AMIA members can come tell us what's on their minds. And we've organized them around 5 different topics on Monday evening and Tuesday evening, so that whether it's clinical decision support or it's health information exchange, that folks can come and tell us what their excitement is about the topics, what their concerns are about the topics, what their issues are, and we can have a dialogue about that. And some of that is going to be education, certainly explaining where we're really going with these different issues.
Okay. Judy Murphy, thank you for joining us.
You're welcome. Thank you.